Hi, my name is Yasu, and in my video I do hitorigoto, and hitorigoto is a Japanese word and it means talking to myself. This is exactly what I'm doing right now. So today I want to talk about I want to answer to the question that's given in the comment section of one of my videos, that I was talking about my experience with going through parotid glands tumor, which is a very rare tumor. It happens 1 in 100 million people or something like that. I forgot. I can't remember the exact numbers, but it's so rare, and doctors has not been able to figure out why this happens to people. So there's no genetic causations or like the lifestyle, nothing like that. So it just happens to people. And unfortunately that happened to me. So in the 2022 around summer, when I was washing my face and touching here, I found some limb, like little hard things here. So I started to see the doctors, and then they found out that there is a tumor, and they said that it's a parotid gland tumor. And of course they did biopsy and everything, and they couldn't tell whether it becomes cancer or not yet. And then around this here, like almost 90% of all of the facial nerve is here. So of course if I would decide to undergo the surgery, then, and if that damages my facial nerves, then it's gonna paralyze my face, as well as there's a lot of the after surgery things that I need to consider, and one of them is Frey's syndrome. So the question that it was given to me was like, did I suffer from Frey's syndrome because of the surgery on the parotid gland tumor? And the answer is actually yes. So Frey's syndrome, I never heard of it before everything happened to me. And what that is, after the surgery, if the patients eat or drink something, the part of here gets red, and then sweating like on the cheeks, on the here, and in my case they cut me open from like in front of my right ear all the way up down here. Like they cut like 20 centimeters of this side of my face and remove everything. And then, luckily speaking, the final biopsy, it says that none of the cells, the tumors did not become cancer yet, so it was really good to go. And it's been a little over 1 year, and I don't feel anything. I already forgot that I actually went through the surgery, but whenever I touch here, I can feel a little bit different. So it kind of reminds me that I actually had the tumor and then underwent the surgery. But going back to the questions, right after the surgery, it got so swollen, and then like I was so scared to eat, and whenever I open my mouth, I can feel something is weird here, so I couldn't really eat that much. But like 2 or 3 weeks later after the surgery, it got better. I can actually eat more. Then I started to notice that whenever I ate, I got sweat, not on the cheek, but like back of the ear and just here. And then I realized that it's a Frey's syndrome. And of course, like I went to see my doctor, and then she told me that it's actually common, and then this is exactly what I explained that to you. But as you can still keep eating, and eventually it will stop. And it did stop after like 2 or 3 months. And I don't even remember exactly, but it didn't last for a long time. And it didn't really be, at least to me, it was not the major issues. But I do realize that, but I do remember back then, after a month since the surgery, my doctor says that now you can drink alcohol and everything. So I actually had some wine and sake and eating some good food. Very tasty, but I can really feel like this part of it is like sweating like crazy, and I can feel that there is a water. It's a sweat, and I got scared. So since then, like I kind of stopped drinking, and then it's not. I think it's not related, but I don't think it's related to my surgery. However, if you saw some of my videos, then right after the surgery, I really didn't feel myself, and then I went to see a psychiatrist, and it was like I had myself checked so many in a different ways, and then they have found out that my testosterone level is way too low as the 80 years old guys. It's just too crazy. And then simultaneously, because I was already seeing a psychiatrist and he diagnosed me as a type depressions and everything, I had sleep disorders. So I started taking antidepressants and doing the testosterone replacement therapy. So overall, like I stopped drinking since last July anyway. But yeah, if you somehow, let's say, after the surgery, if you suffer from the Frey syndrome, first of all, please consult your doctor. Have it checked. And if your doctor says that it's just the way it is, you don't really have to worry about it. Like after a 1 month, 2 months, maybe 3 months, it will stop. Just like it did stop on me. Nothing major, but if you feel uncomfortable or if you feel surprised, like I got surprised, then at least don't drink alcohol. I think it would actually help. Eating something and then sweating here, it can happen, but you need to eat and get energy as much as possible so that your body can recover more quickly. So yeah, that's my answer to the question. Did Frey syndrome occur to me after the surgery? Unfortunately, yes. I got freaked out, I got surprised, but looking back, I don't even remember how long it lasted. I just only remember that it disappeared not long after the surgery. I think it's relatively quickly after the surgery, so nothing major. However, I'm not your doctor, and our bodies, everyone's bodies are different, so please go to see and consult your doctors if that happens to you. And then once again, as always, the closing comment is be and stay healthy. That this, how do I say? Parotid gland tumor. It's completely out of my control. And if it happens to you, it's completely out of your control either, too. Because It's not about the genetic, it's not about the environmental factors, it's not about the eating habits or lifestyle. Nobody knows why this happens to people. That's why it's a very rare tumor. Things happen, but the most important thing is that you need to really look after yourself. And if you feel something here, don't wait, go to see a doctor, have it checked ASAP. The earlier the better, because if they can find something at the early stage, whatever we go through to get better, we can minimize the risks of damaging our bodies, and we can actually have more options to treat those kind of medical conditions. So the earlier, the better. Always looking after yourself. Always stay healthy. Don't push yourself. Life is too short not to enjoy your life with yourself and with people that you love. So thank you for watching my video, and if you feel like it, please subscribe to my channel. So for now, Jane, bye.